right, Carlos, and whenever you're ready.
All right. Good day, everybody. Welcome to My Life Without Limits, a new episode we have today. And this is your co-host, Carlos Gonzalez. And I have the pleasure to have welcome back, welcoming again, Leah Eisen, my guru person behind the show and in front of the show, everywhere, basically.
Yeah,
And welcome, Leah,
thank you.
today on a wonderful either afternoon here for us, morning for the persons who are listening, or evening, depending on what time they're listening.
Yeah, that's right.
So welcome everybody. Welcome Leah.
Thanks.
We have it's been a while since we chatted on this podcast, but
It has.
it's a pleasure to be back. So
Yes, it is.
or to be here today actually. I just wanna let you introduce our our
Yeah.
guest coming in today, which is very exciting.
Yes.
I'll let you introduce her. Welcome for her as well, and welcome to the show today.
Yes, thank you. No, really excited to have our new friend Katie here, and I'm going to allow her to introduce herself, and we'll just get into this great topic. We're going to talk about a lot about kids in pain and
Mhm.
all sorts of stuff, which I think a lot of our listeners will be interested in. So, welcome, Katie, to our podcast. We're happy to have you here. So, would you please introduce yourself and just help our listeners get to know you a little bit better?
Absolutely. I just want to say thanks to both of you for having me today and excited if this conversation gets
Ah,
to reinvigorate and have another opportunity to connect with this community. So
hmm.
thank you for that. So yeah, I'm Katie Birnie. I'm a clinical psychologist and I'm an associate professor at the University of Calgary. And you alluded to it a little bit, Leah, but I'm a huge champion, I guess, for folks with lived experience
Hmm.
and their family members and communities as it relates to preventing and managing and improving pain so
Hmm.
that people can get the best healthcare they need, but also live their best lives every day, right?
Yeah.
And I know that's something that comes up a lot for folks with CP, but also other types of conditions,
Yeah.
and can have a huge impact on daily life. So excited to share some exciting things we have going on, some in partnership
Hmm.
with CP Alberta and
Yes.
otherwise, and see where the conversation goes.
Yeah. No, I think that's great because it's hard. I find it's hard to express pain when you're trying to describe
Mhm.
it, like things are, especially for kids. So I think it's a great
Mhm.
topic, and we'll get into a lot of that stuff. But yeah, so like, how did you get into this? How did you start your career, and what inspired you to become who you are?
Ah, what a great question. I think it's really fitting actually to have this conversation in this space and this podcast because I am really passionate and got into this work because I really saw that folks who were dealing with various medical conditions or other types of health issues, that some folks found it pretty easy to cope with some of those major stressors, and other people had a harder time.
Yeah.
And I, felt like, oh gosh, there's something there that I believe everybody has the right and deserves and can have an exceptional life, even when major stressors or challenges or circumstances
Yeah.
um, show up. Those vary for people in their lives, and but that doesn't have to be what prevents a life that is meaningful and valuable and all of those things. So I really
Mhm.
kind of got into that space of like health conditions and coping and well-being, and that really kind of pursued a career for me in an area called health psychology. So it really brings those things together.
Yep.
And then had a chance to work and train at a few different hospitals and other places across Canada, and spend a lot of time working with children and youth, but also adults and family members, and supporting them through healthcare experiences
Hmm.
and getting back to the things that they love and want to be doing kind of in
Right.
their lives. So, yeah, then that became my whole career. So then we're here.
Then we're here talking to
Then
us.
we're
That's great.
here. Yeah.
Absolutely.
Yeah, because I can imagine, pain holding you back from doing things that you want
Oh
to do,
gosh.
that can affect people mentally, doesn't it?
Absolutely, right? And I think, whether that's pain we deal with every day,
Mhm.
right? That lasts months or years, which we
Hmm.
often call chronic pain, but
Yeah.
also short-term pains that come up, right? From
Yes.
medical procedures, blood draws, injections, surgeries,
Hmm.
those types of things, or even just comfort when, people use different devices to assist them in mobility, right? Those are not always comfortable and can
No.
create
Yeah.
pain. And,
Yeah.
but that can have a huge impact on your mood, your sleep, your energy, your
Yeah.
attention, everything.
Every
So, I think we have to think about it really broadly when we talk about what do we mean by pain?
Yeah. And Carlos, I mean, you can probably attest to that. Carlos has cerebral palsy and
Hmm.
uses his arm crutches. And
Hmm.
I know
I
I
live
see you walking around.
I live in chronic pain all the time, and
Yeah.
it's uh it's it's tough sometimes because you get to handle it most of the time, but some other times you don't handle it at all.
Yep.
Uh, but I have a pretty high tolerance of pain. Uh, I actually do not like the phrase "no pain, no gain" because
Mhm.
I don't really agree with that. I think
Mhm.
that it's uh it's something that affects people psychologically when you're physically in pain most of the time, as
Hmm.
you just mentioned, right? And it affects your entire, not only your mood, but your entire movements, your entire routines, right? So
Mhm.
it's it's
Mhm.
very it's very challenging to live with any type of pain, whether it's chronic pain, whether it's temporary pain, is quite challenging
Yeah,
for
Yeah.
sure.
absolutely. And I think expressing it too, especially for kids, usually you go to
Hmm.
a doctor and they always either show the happy faces and then it's getting more upset or the scale of 1 to 10,
Yep.
But I think even then, because I mean, what is a 8 to me? My child she's 16, but she has zero pain tolerance. And she's the first to admit, like going for acupuncture on her arm, like zero. Like if
Yeah.
she anticipates that there's going to be any kind of pain, she's like, no, I don't want to do it. I'm not going to do it. But for me, I'm like, I can handle, I'm older too, but she's just always been like that. But
Do you
Yeah.
um,
think that's more psychological, Katie? Like,
yeah,
how people bring it up to their to their bodies and say, okay, I'm gonna get this amount of pain, so I'm gonna suffer through this pain. Or are you able to train your mindset to
yeah.
kind of say, we don't want this pain, or I'm
Pain.
not going to go through it?
Yeah, it's a good question, Carlos, because pain
Hmm.
is such a personal, subjective experience,
Yeah.
right? And what we might go through the same thing, but have a totally different experience of pain as a
Hmm.
result. And, the way we think about pain is a lot of things you've mentioned. Certainly are there, pain is driven by our nervous system, right? Like it's our
Hmm.
brain that interprets an experience or sensation as painful. Um, but there's a lot of factors that are there. It might be genetics and biology, but you also mentioned the psychological components of it.
Hmm.
That's huge, right? If you've had a bad sleep the night before, the same experience might be worse or harder or more
Yeah.
painful. That's a really
Hmm.
simple example, but I think we can all relate to that.
Hmm.
But also, if you're living with pain on a regular basis, of course, that might make you feel worried or down, or impact other areas of your life. But then
Hmm.
there's social components to pain, right?
Hmm.
Like how other people react can impact how much we express pain, or culture. Like what culture people come from or, are socialized
Yeah.
in can impact like expressions of pain. So or the consequences, what people need as a result. Like sometimes we'll see people who are very expressive about their pain because they're, needing a lot of support from others. But
Hmm.
sometimes we see people suppress and actually
Hmm.
diminish their expressions of pain because
Yeah.
they feel kind of helpless to manage it
Hmm.
and they're not sure they'll get the support that they want, right? So
Yeah.
it's complicated.
It, it it is complicated, and the way I see it is, at least for me, sometimes when you express pain, you're fearful of how other people are going to react, whether
Totally.
it's in your personal environment or whether it's in your work environment or your
Yeah,
professional environment. Because if they see you in pain, they might say, "Oh, he cannot do this and this and this
Yeah.
because he's going to get worse with the amount of the pain, and we don't want to put them through that."
yeah.
And so on and so forth. So, I personally myself, even when I'm at pain at work, openly I can say that I don't want to express it because if I express it at the end of the day, word comes around, everybody will know that Carlos is in pain, and and uh, and it will be kind of, I will feel a little bit of a fear in myself that something would have any consequence on my
Yeah.
way of living, right? So
Yeah.
Yeah.
it's kind of, it affects kind of psychologically what you think about it, in
Yeah.
my opinion, of how
Yeah.
you react to the pain.
Yeah, that's a great example of that social part, right? And
Yeah.
I think, at work, but you think about that at school or with
Mhm.
family
Hmm.
members
Hmm.
or, other things too. And yeah, all those same things about, how others might respond and, yeah, your own agency and how you want to cope with it too can feel taken away from people sometimes. Yeah.
Hmm.
Yeah,
Hmm.
that's very true. And there's always this sort of competition between men and women, right? About
Mhm.
pain, about who, because women go through childbirth and then, but then it's like, oh, but you do it again, so it can't hurt that bad. And it's like, men don't want certain things happening to them because, oh, it hurts so bad. And it's like, well, why are we competing
Hmm.
Yeah.
Sure.
against what
Yeah.
hurts more, Like that's so frustrating.
Yeah, it's interesting the like sex and gender consideration. So, there is like research, especially around chronic pain, to suggest that females or girls or at greater risk of developing chronic pain. But you also think about how we're socialized in society. Like you mentioned, no pain, no gain, Carlos. Like I
Yeah.
think for a lot of boys and men, it's kind of like toughen up.
Hmm.
Like
Yeah.
there's a lot of that kind of attitude that I
Yeah.
think can be harmful too, right? So,
Hmm.
yeah, there's a lot of factors.
Yeah, there is. And does that play in a little bit when families and parents are advocating for their kids when it comes to the pain that they're feeling and trying to get a diagnosis? Do you think a
Mhm.
little bit that can, play into it? And what things do you see, around that?
Yeah, that's a good question. And I think, there are definitely groups of folks. I mentioned kind of girls and women but there's lots of folks that are disproportionately impacted by pain, but face greater barriers to getting access to care, right? And I think it's
Yeah.
one of the reasons we're doing some work right now, specifically focused on youth with neurodisabilities and, other types of conditions,
Hmm.
because folks with disabilities have been identified as a population kind of
Yeah.
disproportionately impacted,
Hmm.
as are children, right? So
Yeah.
I think, among other groups as well. And so I think that can play a role. And there's lots of in how families, how quickly pain gets identified, how quickly and how
Yeah.
well it gets addressed.
Hmm.
What advocacy needs to look like, you mentioned, Leah, right? By
Hmm.
youth or adults themselves or
Yeah.
family members or other support kind of caregivers,
Hmm.
all are impacted by that. And, sometimes the psychological components, like I said, of course, Carlos, you mentioned feeling fearful. Yeah, it makes sense. Like I see, I'm a psychologist, but I see if you're living with pain, like that's it's an expected response, right? When you're dealing with pain all the time.
Yeah.
But
Hmm.
sometimes that can lead to more dismissal of pain too for folks,
Hmm.
right? That it's, if you were less anxious or less worried, then your pain would be less. But, that's
Hmm.
not necessarily the case either, right? So I think there's barriers that folks really have to advocate about.
Yeah.
The other part I just add to that can come up is how people's communication abilities,
Hmm.
right? You
Hmm.
talked earlier, kids often use different words. If they communicate verbally, they might say
Hmm.
hurt,
Hmm.
or discomfort or something like that. But I think another group that faces even more barriers is those folks who don't communicate using
Hmm.
words.
Yeah.
Because pain is so subjective and invisible, right? Um, that, sometimes people struggle. That doesn't mean their pain is less present or less
Yeah.
valid or less important. But sometimes that can lead to, dismissal or
Yes.
minimizing or, it not being assessed or addressed as well, right?
Yeah. Yeah, I see
What?
that because I'm very lucky to have my grandmother, my nan, still
Mhm.
around. She's 90,
Hmm.
95 this year and in long-term
Wow.
care, very well taken care of. But she was never one to admit she was in pain or needed anything. And now that she can't really convey, because she can't understand what she's saying, but they give her
Yeah.
Tylenol twice a day. Like she just gets it every day,
Yeah.
twice a day, just, because she can't walk or anything. So she's just sitting. But, sometimes I do. I'm always like, are you tell me, show me, like I'll help you.
Hmm.
But she's okay. But I always worry that what if there was something and she can't, express it. And I'm always like,
Hmm.
Is there any recommendation along those lines that you may have about how to identify somebody who's not able to verbally communicate, Leah, I'm in pain, or Carlos, I'm in pain, or
Yeah,
Yeah.
a family member who might be in pain that they're not able to see it. It could happen with a family member, it could happen with a client that you're giving a massage to,
yeah.
and it's not
Yep.
verbal. How would you be able to identify if there's possibility
Yeah.
of identify that?
Yeah, that's an important question, Carlos. And there are some measures out there. So we talked about pain rating scales a little bit
Mhm.
earlier. So there is something called the non-communicating children's pain checklist
Okay.
that goes through, but you don't have to use that. But that's just to let people know there's a lot of work and research that's
Mhm.
been done in
Hmm.
this space. The types of things, the best we can do is look at certain behaviors. So we
Okay.
can look at, nonverbal cues like facial expressions, vocalizations, body movements,
Mhm.
or like, sometimes people will like protect a body area physically, or it will be
Hmm.
much, they'll notice tension, that kind of thing,
Hmm.
grimacing in the face, those types
Hmm.
of things can be indications.
Mhm.
And I think, I always think in this, the folks that know that person best are such a
Yeah.
key source. It's not a replacement for that individual's own voice, even if they can't express verbally, right? So we can use other assistive technologies that some people use for communications, right?
Hmm. Hmm.
Um, but I think, we're often then also relying on those people that are with them the most,
Hmm.
spend the most time with them to say, is this different from how they normally are? Right.
Yes.
So,
Hmm.
looking for changes in
Mhm.
behaviors or mood can be an indication
Hmm.
of pain as well.
Yeah.
Um, but it's tricky because there's not like a medical test that we can
Hmm.
do to say, oh, there's pain, right? And
There's
not like
pain.
an X-ray or
Yeah.
an MRI
Not
or
yet.
anything like
Maybe one
that.
day.
Not yet,
Yeah.
maybe one day. So that makes it hard. So I think we do our best. I
Mhm.
do know though, like some families, if they're not sure, like I've partnered with some families in the past who have had youth with more complex medical needs who can't communicate much verbally. They've noticed changes in behavior over time, but then have gone in and said, "Hey, is it possible it's pain?" And then been able to work closely with their health team to actually try
Hmm.
to treat for pain
Mhm.
and
Hmm.
see whether that's made a difference. And in some instances, that's led to a total change in behavior.
Yeah.
And
Hmm.
so they've been able then, kind of in retrospect, through trialing pain management strategies to say, oh, wow, like we didn't realize, but maybe some of those symptoms or behaviors or, challenges were actually indications of pain, but we couldn't
Okay.
Hmm.
differentiate it from something
Yeah.
like hunger or irritability or,
Yeah.
those types of things too. So yeah, really kind of looking to behaviors is the best, the best, the closest, I
The
guess we can
closest.
get. Yeah.
Yeah.
And what if the behavior is the same pattern all the time? Because, for example, I know somebody, well, I used to, when I was a kid, I used to laugh when I was in pain because
Mhm.
I didn't want to scream. So
Mhm.
I'm going to laugh to kind of cope with the pain, but I also, because I'm nervous and I'm in pain, my reaction to it was to laugh, you
Yeah.
know? And the same thing with my brother. When my brother was getting hit by a kid, you know, when he was a kid, um, he started to laugh as well. So I noticed we noticed that it was like hereditary from family
Mm,
to family to do kind of like
mhm,
similar behaviors. What if you
mhm.
think the kid is laughing and he's not in pain and you keep, you know, keep
Yeah.
hurting him? How would I notice as a as an individual that the kid is actually in pain if the
Yeah.
behavior is still the same, over and
Yeah.
over again, right?
Gosh, what an interesting example, Carlos. I have questions. I think, one of the things you touched on is we learn how to express pain often by watching those around us.
Hmm.
Yeah.
So that's one thing, right? You commented like, oh, my brother also kind of did this. But I
Hmm.
think, in those moments, looking, sometimes you can look at and observe a situation and say, gosh, that seems like a painful thing.
Hmm.
Is that,
Hmm.
and just observe that over
Observe it.
time and say,
Hmm.
oh gosh, like that seems objectively like it might be painful. Does that
Hmm.
happen,
Hmm.
over time? But I'm curious, how did you start to, or maybe you still laugh when you're in pain? I don't know. But like how did you learn that about yourself over time?
Because I still do it. Even when
Yeah,
I'm in pain, I laugh, right?
yeah,
Because I feel like, I don't know, I think psychologically in my head, if I laugh, it's going to go away. The pain
Yeah.
is going
yep,
away. But
Yeah.
then
yep,
you realize that the pain is not going away because it's still
yeah,
there, right?
yep,
So I still do it. So I realize that from when I was a kid, even when I was doing physiotherapy, like would you going through physiotherapy and
yep,
they do stretching, I used to cry quite a bit for sure, but then
yeah,
I started to go upon, I don't want to cry because I don't want to show my mother some vulnerability or some weakness. I'm
yeah,
gonna start laughing to the
mm,
point of like trying to cope with this pain and trying to see if this pain goes away. And then
yeah,
the older I'm getting, the
hmm,
older I'm noticing that I do the same thing. I fall
yeah,
down and I laugh, you
yeah,
know, and I could be with a bruise in my finger and nobody will notice, and I'm laughing at it
yeah,
until the next day when I wake up and the bruise is bigger and black or purple, that's when you
yeah,
realize, okay, you actually hurt yourself,
yourself.
type of
Yeah.
thing, and it's not going away, right? So
Yeah.
Yeah.
I
I
notice
think,
that pattern.
yeah.
Yeah, no, it's interesting. I think what's so great about what you're sharing is you're aware of that,
Hmm.
right?
Yep.
Like about yourself too. And I think
Yeah.
if it was, a parent or a caregiver, like
Hmm.
knowing that,
Yeah.
about
Hmm.
your kid or your client or who you're working with, then
Hmm.
you just might ask a follow-up. And then, that it just leads you to be a bit more curious, right? So instead of hearing that laugh and then saying, oh, they think this is funny or, whatever else, you might say, oh, sometimes I know Carlos or, other person does this when they're
Yeah.
hurt. I'm just going to check in,
Yeah.
right? And say,
Yeah.
hey, are you okay? Right? Like you just kind of follow up on that a little bit more. Because I think what you're hitting on too is there's no single way that people express pain,
Hmm.
right? And we're always, it's inherent in us as people, as humans, regardless, to try to cope with it
Yeah.
in some way, right? And so, if that's, and then it becomes, is that coping strategy helpful? And if it
Hmm.
is, great. There's nothing wrong with that, right? If it's working. I think we always think when we're talking about managing with pain, thinking about it in like a toolbox of strategies, right? Things like humor, things like feeling, like building your own strength in coping is one of those.
Hmm.
And not just relying on things like sometimes medications are helpful for pain, right?
Hmm.
But medications alone are not kind of a whole comprehensive approach to
Yeah.
managing pain too. So I think, those are things that, as you were talking, kind of came to mind for me.
Yeah. We
Thank you
joke
for
about
sharing
that
that.
at my daughter's softball games, all us moms. Oh, we got to take our Advil, our daily
Yeah.
Advil, even though we're just sitting here watching them play softball. We're all taking our Advil, just, you know, middle-aged women. Yeah, it's a
That's
thing,
funny.
right? So let's talk a little bit about your involvement with solutions for kids in pain, and that you're working on. Can you just tell us a little bit more about your work in that and why you think it matters?
Sure. Yeah, we've got a couple of exciting things going on in partnership with
Yeah.
CP Alberta and others.
Hmm.
So Solutions for Kids in Pain, or SKIP, that you mentioned, is a national group that I get to work with closely. That's really on a mission to unite partners together to improve pain care for kids across
Hmm.
the country. And we are doing a project right now that is specifically focused on children and youth with neurodisabilities. So that very broadly. So that can include folks with like autistic folks, folks with
Mm,
FASD, with cerebral palsy, with intellectual disability, with, some folks who don't even have a diagnosis, right?
Right.
But,
mm,
Hmm.
are, or have a rare condition,
Hmm.
that impacts how they think, learn, communicate and in the world. And so we are working together to create new tools and resources for families themselves, for youth, for health professionals, and also for hospitals across the country to try to make sure that these children and youth get access to quality, equitable pain care.
Hmm.
They're often, they're more likely, I said earlier, more likely to kind of experience pain,
Hmm.
whether that's medical encounters for care or treatment. You mentioned one, Carlos, which sometimes people don't think about. Some of the treatments we have are
mm,
actually painful, right? So
Yeah.
you need to
Yeah.
do them, like
That's
physical
right.
therapy. It's important, for
mhm,
functioning and other things, but
mhm,
that can be painful too, even if it's
mhm,
what we need to do. But also then things like surgeries and medical procedures or
mhm,
chronic pain that comes from all sorts of things too that can last months to years. So we're really focused on building awareness that this is an issue and then also sharing effective strategies for quality pain care. So that's
Hmm.
one exciting thing we're doing, and all of that's
Hmm.
in partnership. And then we have another project focused here in Alberta right now with some other colleagues here at the University of Calgary and across the province, where we are looking to identify and figure out from the community what are priorities or gaps in
Hmm.
managing pain for children and youth with neurodisability in Alberta.
Yeah.
So, there's a lot of good things that are happening, and
mhm,
we got to share about those and make sure everybody knows about them. But there's gaps, and we know there's gaps. And so, really us not coming up with what those gaps are, but us talking to people, hearing from folks in the community all across the province to say, what do you think matters? What do you
Yeah.
think is needed to improve pain for children and youth with neurodisability in Alberta?
Yeah.
So
Yep.
it's a lot of stuff, Leah and
It
Carlos,
is a
but
lot.
that's what we
Yeah.
got going on.
Yeah,
That
and that's
sounds
such a
really
big part of
exciting.
my job. Yeah, is getting the word out about research projects and surveys and all sorts of stuff too. I'm part of
Hmm.
so many groups on Facebook and social media of parents that just love being part that they want to be part of all this stuff and so they can learn more about their kids and how to better advocate for them and then
Mhm,
the effects it might have on the siblings of the children and all of that stuff.
Sure.
So
Yeah. Yep.
that it's great no for us to focus on it and we're so excited. I'm so excited to just share all the information. Cindy and Joanna will send me here's some more stuff from
And
Yeah,
the,
that's
Skip.
great.
and the
Let
question
me
that I
know.
have, because I just take a look at your website and everything you do earlier before we started the show, but I was wondering for that gap that you're looking to kind of bring in more information. Are you doing them more through surveys, through through phone calls, through meetings with some clients? How has it been done? Just in case some people hasn't had a chance to look at what you're doing and they want to
Yeah.
maybe participate on the
Ah, yes.
yeah.
And we can certainly, I'm hoping when you post this that you can put the link to the survey. So we
Yes,
have
Mhm.
for
Oh,
sure.
a community survey open right now. It does not take long to complete. And it really just asks what are what priorities, questions, concerns do you have about pain for children and youth with neurodisability in Alberta? It's pretty much as simple as that. You can list, up to three different things, and we want to hear from all sorts of folks. So if that's
mhm,
you and your own lived experience, if you are a family member, if you are a health worker or other caregiver or just an interested community member that cares
Hmm.
about this in some way, you're a partner, a friend, whoever that is, we think you have expertise and we'd love to hear from you. So that survey right now is going to be open until mid-July. Um, that's just the starting phase. So that's really public. Anyone can share. And then what happens after that is we combine them all and turn them into a shorter list,
Mm-hmm.
send that back out to the community. So there is
Hmm.
a second opportunity
There's a
to,
second opportunity. Okay.
yeah, to share how important you think each of those are.
Mm-hmm.
And then the last phase is actually a consensus building workshop. So, and that's where a group of about 30 folks from across the province will come together and reach consensus on the top 10.
Mm-hmm.
So, and
Mm-hmm.
then that's really the beginning of the work. So then we've
Yeah.
identified what are the gaps, what are the priorities, and then it's about us coming together to
Mm-hmm.
say, okay, how do we address those? Right.
Mm-hmm.
And there may be a role for researchers or health professionals, folks like me, but there's a role for community
With
members
the
and community
community.
Yeah.
organizations, often to fill those, or for policymakers or
Mm-hmm.
Yes.
folks within the health system, those kind of decision makers to say more support is needed here, or this is a gap, that we can fill. And so I think, we're at that first phase of just
Hmm.
kind of trying to hear from people as well. And if folks want to talk by phone or want to share other ideas,
Mm-hmm.
when they click on the survey link, there's information to contact us. And so
Oh,
we're
there is.
Oh,
certainly
Okay.
great.
open. We've
Hmm.
tried to make it as accessible as
Yeah.
possible, but we know people like to communicate in different ways and that kind of stuff too. So we're always open for a phone call or a chat in another way too.
That's
Wow.
awesome.
It
That's
Yeah,
is. Yeah.
fantastic.
And have
yeah.
you had any sneak peeks into what people are saying so far that are
Ooh.
identifying a few little gaps that maybe you can share with us?
Yeah, that's a great question. We haven't done a deep dive into it
Hmm.
yet, mostly because, we've really been focused on just trying to share awareness that
Yes. Yeah.
it's
Mm-hmm.
happening and not wanting to jump to conclusions, right? Too
Yeah.
many things ahead of time. But some of the things that we certainly expect that I think are starting to show up, we've touched on some of them, right? Some of
Hmm.
them are how do we know when folks are in pain? Like how do we assess pain and communicate about pain? I think, things we expect to come up and a huge goal for this project is to get outside the hospital, right? The
Yeah.
hospital's not where people live or want to
Yeah.
be, right? They want to be at home and in their communities.
Yes.
And so I think how we support kind of access and engagement of pain care and pain management out in the community. So whether that's at school, whether
Yes.
that's at work, whether that's, at home, whether that, like, whatever that looks like, whether that's in other activities, that hobbies, things that people engage in. So I expect there'll probably be some things that come up there.
Yes. Yeah.
Um, especially when we think about, we've got some big cities here in Alberta, but
Hmm.
we got a
Mm-hmm.
lot of people who don't live in those big cities
Yes.
Mm-hmm.
that are
Yep.
still deserving, right, of access to quality care and pain management. So I suspect there's going to be some things that come up around that too.
Yeah, I think so. Yeah, we talk a lot about that through our barrier-free initiative and Alberta Ability Network about the barriers to everything. And yeah, health and all of that stuff is
Mhm.
always brought up. Yeah.
Yeah.
Have you found any challenges like by giving away or trying to give away that survey, or have you found any challenges or any responses that are challenging for you guys that you'll be wanting to share? What are some of those challenges?
Sure, happy to. I think, I think as we were just talking about people who live in rural areas or who live
Hmm.
in remote
Mm-hmm.
communities,
Mm-hmm.
I think, finding the ways to reach those folks
Yeah.
and make sure they feel heard and that, they recognize they're important in this process and how do
Mm-hmm.
we connect with them, right, is important. Funnily enough, like I think we're also trying to make sure we get often we're missing folks with lived experience, and we still absolutely want to keep hearing from those folks.
Yeah.
Mm-hmm.
But there's also other professionals, workers, support caregivers, and such that we haven't heard too much from yet either. So
Hmm.
I think we're kind
Okay.
of interested in that. And, um, yeah, so those are kind of a couple of things. We were chatting with our project team last night about some strategies for reaching different
Hmm.
people across the province too.
Oh, good. Yeah.
Yeah, yeah. So we're about halfway there. We're hoping to get to about 150 people, and I would say we're about at 75 now. So
Okay.
we're
Yeah.
eager to kind of keep 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 listening. But
That's
I'm curious, Carlos, like what do you think matters? What do you think are the gaps and priorities?
What do I think? Well, I think we touched base on most of it. I think the most important for me is to be able to identify the expressions that people
Mm,
have and identify how, because for most people, it's so hard to again to communicate that
yeah,
whether they have verbal challenges or not. Even if you don't have a verbal challenge, psychologically speaking, I keep
Yeah.
thinking that people have this this thought in their brain that they don't want to communicate it. And I think that in my opinion, from what I learned from what we have talked about today is we just have to be open to
mhm,
try to be more vulnerable
mhm,
to the pain because it's important to for me the fear is and has always been if I don't express it at the end of the day it's going to affect more on your life and it's
Hmm.
going to have a harder outcome on your life if you don't
mhm.
express it, right?
Yeah.
But in my fear, my most fear is for those people who cannot express it
Yeah.
and other people are not able to identify it. I
Yeah,
think that will be the gap of like, this how can we actually reach those people to be able
yeah,
to like listening and the most important that I heard from you today is how do we reach the people out of the big cities, right? Because
mhm.
they might be in pain and and they might not be able to spread it. They might not be able to come all the way to to the big cities
Yeah.
to be able to come with somebody like yourself or some other professional that will be able to help them identify that, right?
Hmm.
Yeah. I
Yeah.
think one of the things I'd share too, thanks for sharing that, Carlos. I think one of the things I would hope people can hear from today too, and you brought up Skip Solutions for Kids in Pain, Leah, which has a
Hmm.
website and social media, is that there are strategies to help,
Yeah.
right? I think
Mm-hmm.
folks often feel very isolated in their
Mm-hmm.
experience of pain, or often aren't sure that more can be done to help, that there
Yeah.
Mm-hmm.
are accessible strategies for them to manage pain. And
Yeah.
some of these things are relatively simple, like,
Yes.
you mentioned humor. I often think, like, I remember coming down to the CP Alberta space in Calgary, and there was a music therapy
Oh,
Yes.
program going on.
yes.
Yes.
Gosh,
We
like, what
we
a
love
great
that.
example,
We
Yeah.
love
right?
that.
Of
Yeah.
like, an intervention or an opportunity or an activity that can help with pain management.
Mm-hmm.
Sometimes it's positioning, like comfort positioning,
Yes.
Mm-hmm.
right? Like sometimes it's using things like heat or cold.
Yeah.
Sometimes it's even just letting people know for needle procedures, you can get something called a numbing cream
Right. Yeah.
Oh,
that can go on the
look at that.
skin that
Yeah.
helps to numb the skin. And that's
Mm-hmm.
something you don't need. You have to get it over the counter from a pharmacist, but you don't need a prescription for that.
Hmm.
And so if
Oh,
you have
wow.
to get a blood
Okay.
draw or an injection, those can
Mm-hmm.
help. Distraction. Lots of people have
Distraction.
devices. They can
Yes.
watch like I mean, this is probably not the best. I mean, it's a great, we're chatting, but like YouTube videos are a great distraction,
Sure.
right?
Yep.
Yes. Yes.
Music,
Yep.
There is.
games, like these are all things that part of our goal with Skip is to say some of these things are helpful for pain.
Yeah.
And it's just letting people know and, building awareness about that. Yeah.
Thank you
Yeah.
for sharing that because I never would have thought that, for example, watching a YouTube would be a distraction,
Yeah. Well, at the
from
Yeah.
pain,
dentist,
from
they'll
pain,
put, you can
Oh
watch
yeah,
cartoons like when you're at the dentist, you lay back
sure.
and they've got it on the
Yeah.
ceiling or something to help, yeah, kind of get that. And I remember my daughter, she has ADHD and like I said, low
Yeah.
pain tolerance. And when I used to
Yeah.
clip her nails, like for some reason it was like the most painful thing. And I
Yeah.
was just doing research into it and I found I read somewhere that if you give her something that's vibrating to hold, it
Yeah.
sort of helps distract from the feeling in the other hand that you're trying to clip
Mm-hmm.
her nails,
Mm-hmm.
and
Yeah.
so we would find something and then she'd hold it and and it just
Yeah,
takes
it's
away.
amazing, right?
Hmm.
It's kind of like our all pain, like pain sensations kind of processed in our brain. And so if we're
Yeah.
using, but our brain can only focus on so much. And
Yeah.
so
Yes.
if we're able to distract it into something really interesting,
Yeah.
interactive, engaging, funny, all that kind of stuff, it
Mm-hmm.
doesn't necessarily mean pain goes away completely.
No.
Yeah.
But that shift of attention can
Yeah.
actually sometimes make it more manageable or, that
Yeah.
kind of thing in the moment. So, yeah, I think, wanting people to know there are things that we know can help. That's
Mm-hmm.
kind of our skip work, right? And then our other work with this Healing Children's Pain Together project in Alberta is saying, but we know there's more we can do. So let's
Right.
hear and figure that out, and then let's
Mm-hmm.
address those gaps together.
Yes. Yes. And is there anything that you're seeing in pediatric pain care that's on the horizon that is giving you a little bit more hope
Yeah.
in this field?
Yeah, I mean, I think exactly what we're talking about here. We are not the only people that are really focusing on trying to improve pain care for children and youth with disability.
Yeah.
And that's exciting for me
Yeah.
because I remember when I first got into this work, more than 15 years ago, we were surveying all children and families at a children's hospital, not here in Alberta, but elsewhere in Canada. And we wanted to talk to everybody. And I remember, one of the nurses in charge of the unit said, "Oh, you don't need to go in and talk to that family. That child's autistic." And
Mm.
we were like, no, why would that make a difference? Right.
Yeah.
And so when
Mm-hmm.
I reflect now, 15 years later, on how research is advancing and healthcare is advancing and our prioritization on quality pain care for
Yeah.
everybody as a fundamental human right. We're not there yet. Are we perfect? Absolutely not. But the momentum and focus and interest in this is so much higher
Yeah.
and
Mm-hmm.
really for all kids, all families, all individuals, not just those that can talk about their pain clearly, not just those that, so I think that's giving me a lot of hope.
Hmm.
Yeah.
Yeah.
That's
Yeah, and I
awesome.
think when you said making it more manageable, I think
Hmm.
that's such a great goal. Is like, we may not be able to take it all away, but we're going to help you make it more manageable. And it
Yeah.
just kind of makes you feel like, oh, it just sort of is, I don't know, the word manageable just sort of
Yeah.
lends to,
Mm-hmm.
a little bit of relief.
Yeah. Yep.
Yeah, no, that's good. So as we round out our discussion, is there any last words that you would give to families? Any advice when they're advocating for their kids? Just anything that you think that they could say if they're feeling unheard?
Yeah, gosh. I think the first thing I'd say is, especially to parents and caregivers or others, trust
Mm-hmm.
your gut. If
Mm-hmm.
you think your kid, your kid or your, best, right? You
Yeah.
spend the most time with them. Sometimes pain, we've talked a lot about how pain can show up in different ways.
Mm-hmm.
Sometimes it seems like a lot of disruptive, loud behavior. Sometimes it's quiet and it's
Yeah.
watching a child kind of disappear into themselves, right?
Yeah.
Sometimes that can be indication of pain. So I just would say trust your gut,
Yeah.
listen and try to hear your child's voice,
Yeah.
however that shows up.
Yeah.
Sometimes that's with words, sometimes that's not. But then also, trust your gut. And if there's a need to kind of ask more, quality pain care is a fundamental
Yeah.
human right. We are all deserving of
Yes.
that. And so ask what's being done,
Yeah.
don't assume. But then also, trust yourself,
Yeah. And
like in that
document,
process.
right? Like I
Yeah, yeah,
love how so many of our families are on Instagram. And like we don't always want to be putting our kids' lives out there, but at the
yeah,
same time, it gives them that ability to look back and say, okay, well here,
yeah,
she was riding her bike and it was fine, but now in this video it looks like, maybe she's favoring this side. So I think it
sure.
helps, document and
Yep,
write things down. And so then
yep.
that way you can say, look at,
Yeah, you can kind of start to build up a bit of that information for yourself, but
yeah,
also you need to communicate it to other people.
yeah.
Yeah,
Mm-hmm.
And I think the
Yeah.
other thing I'd just say is know there's a community out here that's really
Yes.
working on this. And so if you're looking for credible information, Solutions for Kids in Pain's website, social media is a great place,
Yes. Yeah.
right? If you're looking to share your thoughts and perspectives, right? And to engage more,
Yeah.
we'll put that, I'll share that survey link so you can share it out
Yes.
Mhm.
too. But,
Yeah.
and if you've just got other ideas, all the work we do based here in Alberta, but also nationally, is always in partnership with people with lived experience,
Hmm.
their families and caregivers and organizations. And so
Yes.
if you look and you're not seeing the thing that matters to you, let us
Yeah.
know. If you want to be more engaged, reach out. We're always happy to work and partner and listen to others.
No, that's wonderful. And we'll be
Thank you for
sharing
sharing.
it and
Yeah,
through our
thank you.
partnership, we'll be continually, sharing everything that happens. And we're
Yeah.
really, really proud to be part of
Absolutely.
this.
Well, we're
Absolutely.
grateful. I think, none of us can do all of these. No person or
Yeah. It takes
setting
a
can
village,
kind of
as they
tackle
say.
all of this, right? So we're really,
Yeah.
really grateful to CP Alberta as a
No,
key
thank
partner.
you. No,
Yeah.
Thank you. Thank you.
happy.
Thanks so much.
So before we finish off, we'd like to ask you, um, as we talk about life without limits here at CP Alberta and my life without limits for this podcast, what does life without limits mean to you, and do you feel that you live your life without limits, Katie?
Ooh. So what does it mean to me? It means to me that people feel supported and celebrated for who
Hmm.
they are in the world, and they feel free to um, I don't know, express what they care about and what they
Yeah.
Hmm.
love, and that feels celebrated by other people. That to
Yes.
me is, and regardless of what those things are, right? It's like
Yeah.
what matters to you. Do you get to kind of live in the world that way, not what matters to somebody else?
Yeah.
That
Hmm.
for me is a huge part of it. And gosh, do I get to do that? I would say most of the time. I would say it's hard to do
It
that all
is.
the time.
Hmm.
Yeah.
I don't know. That would be, gosh, feels amazing. But I will say, especially as I've gotten older in life and, experienced more challenges in my life,
Hmm.
which, are going to be different than others.
Mhm.
Finding ways and people and community
Yeah.
Hmm.
who can support that for me and investing in that and those things,
Yeah.
whether it's
Hmm.
professionally, whether it's personally, um, that's helped me do
Yeah.
more of that.
That's
Yeah.
Yeah.
awesome.
Good.
Yeah.
Nope, that's great. We've been learning from so many people over the years about what it
Hmm.
means to them, and it's all different for everybody, but
Totally.
and that's
And it's such
that's
such
great.
great such great answers all the time.
It
I
So
is.
bet.
I love
Yeah.
it.
No wrong
Every
answer, really.
listening to every answer is always very amusing for me and very interesting to hear. So
Yeah.
Yeah.
thank you so much for sharing that very, very much.
Yes.
And thank you for being a part of this podcast because
Yeah.
it's been an honor to have you here.
Yeah.
It's been an honor to be able to hear what all the work that you've been doing. We will definitely provide all your information for
Yeah.
people to come across of all the great work you're doing. And I'm quite certain that this survey is going to go to reach out to so many people
Yeah.
uh, across the province and across the country as well.
Yeah.
So that
And
would
we'll
be
have you back when you have,
Oh, yeah.
some
Please
data in. We'll
do.
have to, because I
Yeah.
mean, we could probably talk for so long about this.
I'm
absolutely.
sure.
There's
Well, and
lots.
yeah, that would be great. And we've got lots of other team members and other folks with lived experience that will maybe be interested in joining. But
Absolutely.
That would be
Anytime.
awesome.
We're
thank
always
you
Anything.
so
looking for people.
much. Yeah, thank you so
Absolutely.
much for the invitation.
Thank
This
you.
has been great.
Yeah. Good.
No, thank you very much, and thank you all that are listening today. Thank you for taking the time to listen to us and to
Hmm.
listen to what Kate has been doing. And thank you, Leah, for all your hard work in this,
Oh,
and for all
love it.
your background and everything that you did,
No,
not
thank
only
you.
today but always. Thank you so
Thank you
much.
for sharing your lived experience, which is what I like
Mm.
having here is you being able to share. So thank you for that too.
Yeah.
Oh, thank you
Yeah.
very
Thank
much.
yous all around.
Yeah, great.
Exactly. Thank you all around.
Yeah.
And well, thank you so much. And we'll definitely see you next time. And do not forget to live your life without limits.
That's right. Thank you.